the 2024 Ramon Magsaysay Award, the Rural Doctors Movement. For many developing countries around the world, universal health coverage remains an elusive dream. Poor people living in the countryside are often the most affected, with little or no access to the most basic health services.
For Thailand, now an upper middle income economy, this is no longer true. Universal health coverage was finally implemented in 2002, and it has since been hailed as a system that offers largely free medical care to Thai citizens. But UHC and other landmark achievements in the Thai healthcare did not happen overnight. Rather, they were the result of decades of struggle waged by progressive, visionary, and dedicated Thai physicians in both professional and political arenas to secure adequate and affordable health care for their people, especially the rural poor. Those doctors banded together in what has been called the Rural Doctors Movement, a combination of the Rural Doctors Society and the Rural Doctor Foundation. While many doctors belong to both, the Rural Doctors Society is an informal and more flexible organization, and the Rural Doctor Foundation is a formal NGO comprising doctors working in public hospitals. The emergence of the Rural Doctors Movement is rooted in the 1960s, when many Thai medical professionals left for greener pastures abroad. This forced the government to impose compulsory services in the countryside for medical professionals, exposing them to its harsh realities. In the early 1970s, a pro-democracy movement swept Thailand, advocating for greater freedom and socio-economic justice. Many idealistic young doctors joined this movement. Students went to the rural areas to study poverty and inadequate health care. This experience and awakening are best expressed by the former president of the Rural Doctor Society, Vichai Chokavivat, who recalls that, and I quote, "When I was a rural doctor, I saw many people taken ill and becoming almost penniless. They had to sell their farmland or even their daughter to get enough money to pay for their medical treatment. It was such a painful and bitter experience that we dreamt of providing free medical care for the sick." End quote. In 1978, following the brutal suppression of the student movement, many medical students sought refuge in rural areas. To be able to continue to operate under the new regime, the Rural Doctor Society and later the Rural Doctor Foundation were formed, with leaders with activist backgrounds, among them Chokevivat, Chuchay Supangwongsi, Ringsak Wacharan Nukulkit, Supat Hasuwanakit, and the late Sagwan Nita Yarun Fong. The RDS fought for greater civil liberties against corruption in the 1990s. Through their influence in health governance, the Rural Doctor Society doctors continue to advocate for policy reforms. Through the more formal Rural Doctor Foundation, progressive healthcare programs are implemented more effectively utilizing official channels. The impact of the movement on Thai society is palpable and enduring. Thailand's rural doctors have demonstrated how vital adequate and affordable health care is to social justice, how necessary democracy is for positive social change, and how the spirit of volunteerism can achieve superlative results.
In electing the Rural Doctors Movement to receive the 2024 Ramon Magsaysay Award, the Board of Trustees recognizes the historic and continuing contribution to the health of the Thai people, and perhaps just as importantly, to their recognition and fulfillment as citizens with basic rights. By championing the rural poor, the movement makes sure to leave no one behind as the country marches forward to greater economic prosperity and modernization. Ladies and gentlemen, 2024 Ramon Magsaysay Awardee from Thailand, the Rural Doctors Movement.